You know, we often don't think about how much we use our hands. I mean, I'm holding an iPad, I'm running what I'm going to say. We don't think about it until it becomes too difficult to even do those simple tasks. Doctors say hand and wrist numbness is a common issue that can get worse over time. WFMY News 2 Sydney Moore met one woman who learned that firsthand and the doctor who helped her get answers.
35-year-old Aniqua Duff. She welcomed a new baby into the world about 2 years ago, a joy any mother feels. But the beautiful gift of life came with unexpected challenges. Duff noticed numbness in her hand. Her fingers tingled and her grip weakened.
Fingertips started going numb, like my middle fingers. So I was like, yeah, this is not normal.
She struggled doing her baby's hair, even picking up simple items.
Like, if you pick up a jug and you pick it up the wrong way, it was sending like tingles from my wrist all the way up to my shoulders.
That's when she knew she needed to see her primary doctor.
She just referred me to Cone Health.
She soon learned she had carpal tunnel syndrome.
There's a nerve that runs through your wrist that goes basically to your thumb, index, middle finger, and then a portion of your ring finger that lives in a physical tunnel at the level of your wrist. Carpal tunnel syndrome is when that nerve is being squeezed.
Dr. Agarwala, a hand surgeon at Cone Health, helped care for Duff after her diagnosis. He says people often get diagnosed as they age, but it also can impact pregnant women.
So younger women can sometimes get it as part of their pregnancy because of the fluid levels on their body.
He says Duff went through a minimally invasive treatment called endoscopic carpal tunnel.
By doing it minimally invasively, we can open up the carpal tunnel without a large incision in their palm. We can allow them to resume their day-to-day activities immediately.
I was back in action like day 5.
Duff says she is thankful she can fully use her hands again.
I was able to travel with her, do her hair for the trip, put on her clothes for the trip. So it's like the little basic things that a lot of people do take for granted.
Finally living the motherhood she imagined.
We want to highlight how you can spot the warning signs early and what you can do to protect your hands and your wrists. Dr. Agarwala with Cone Health OrthoCare, who you just saw in the story, he's back with us to talk about ways to prevent, manage, and treat carpal tunnel. So let's first exactly just kind of do the 101. What is carpal tunnel, and then what are the signs and symptoms?
Sure. So carpal tunnel is just a compression problem. It's basically your nerve at the level of your wrist is becoming squeezed. It lives in a physical tunnel, and over time, the swelling and the ligament that makes the roof of that tunnel can start to create compression on your nerve. Essentially, what it's doing is it's not allowing the nerve to function the way it's designed, and the hand starts to get numb, tingle, and start to create pain and burning.
Okay, and would that be like an all the time kind of numbness, pain and burning, or off and on?
It can start intermittently, where you start to notice it maybe at nighttime. Oftentimes our wrists are bent at night, and we may wake up at different times in the night with our hands numb and feel like we need to shake them out. Sometimes people will describe waking up in the morning with their hands numb, or start to notice it more often with the wrist bent while driving, using a phone or an iPad, something like that. And so the intermittent nature of it is how it begins, but then it can start to become more constant.
Yeah, simple things, not like picking up something heavy. It really is something small that you're doing. Okay, so
Right.
Who's most at risk for getting this?
Sure. So there's certain medical problems that can be associated. I think diabetic patients are quite commonly affected by carpal tunnel. Sometimes rheumatoid patients can get it as well, or people with thyroid issues. It can come often in pregnancy, which sometimes goes away at the end of pregnancy, but often can last. And certain modalities like obesity or things like that can also be associated too.
Okay, are there any things that maybe can trigger it, or activities or daily habits that we're doing that could make it worse that we should be aware of?
So repetitive motion is usually the biggest culprit. So anybody who's doing a lot of repetitive motion with the wrist back and forth, I think are the most affected, or people who need to keep their wrists in either a bent or extended position for a long period of time. So people who find themselves kind of locked in a fixed position for their job or for recreational activities tend to start noticing it earlier.
Yeah, I'm thinking of that repetitive motion of all of us typing on a computer for sure.
Yes, that's probably the biggest offender.
All right, and so I'm thinking extended time typing can certainly put us most at risk.
Yes, I think especially when you have your wrist in a bent position. So often I'll tell people, if you can get your wrist in a more flat position or an ergonomic position rather than keeping it bent like this, that can often help, because in a lot of cases people need to use computers for their job or for recreational things.
right? If we can't do that, because I'm thinking of my own desk and things of that nature, do we need to like stop every like 20 minutes or something like that and move them around?
Intermittent breaks, I think, are good, often for just stretching. For example, moving your wrist around or trying to prevent kind of that locked, fixed position for a really long time. So I think periodic stretches, if it's going to be something you're going to do over the course of the day, can certainly be helpful.
Okay. Now, if someone starts to notice that tingling or that numbness that you were talking about, what steps can they take at home to relieve the discomfort or maybe prevent it from being worse?
Sure. So the biggest thing we'll talk to people about is activity modification. So if you're noticing a lot with certain repetitive motions, potentially taking breaks or things like that. Using a wrist brace can often be pretty helpful. So it's something that, you can buy at a local drugstore, or something as simple as, again, just keeping your wrist in that straighter position, often as a reminder. That's something simple. I'll often tell people to wear the wrist brace at night too, particularly because we tend to sleep with our wrist bent a lot without realizing it. And that's a very risk-free way to try to help treat the symptoms when they first come on.
So at what point, if people are having the numbness or the tingling or the pain, should they contact a specialist?
I think if it's starting to become more invasive in your day-to-day activities or really limiting you from doing things, people, I think, ignore this problem for too long, to the point where I think they wish they'd come in and seen us sooner. So oftentimes, once people hear about the treatments and what's out there, a lot of times they'll kind of mention, oh, I've been dealing with this for probably longer than I should have.
Right. And so, the big thing is a lot of people would say, well, it's time to get surgery. And then so that scares a lot of people off treatment wise. But when is it time to consider surgery? And then what should they know about today's procedures?
Right. So, yeah, I think surgery is a scary thing. So coming in to see a surgeon can be an intimidating visit. I think the biggest thing about carpal tunnel is there's a lot of preventative things that we can try to help coach people on. So there's therapeutic exercises and stretching, things that we can show them. We can put them in touch with a hand therapist who can work with them a lot. There's injections that we can try, types of medications that can be utilized to try to alleviate symptoms. But then I think the biggest thing that we have now are these minimally invasive ways to relieve carpal tunnel surgically, one of them being endoscopic carpal tunnel. So that's something that's quite exciting, that's really allowing people to get back to their function and work a lot quicker, which I think was people's major hesitation in the first place, was thinking they were going to be out for weeks to months. The really nice part now is with endoscopic, we essentially just make a small little incision here beneath the palm, put a camera in underneath the wrist and release it from the inside out. The beauty of that is it allows people to regain and resume their function immediately. So there's really no time spent away from work or activities that's excessive. Sometimes there can be some soreness and things like that as you recover, but it's really, I think, opened the door for a lot of people to get this done in a lot more timely manner, so they don't have to make as much arrangements around it or plan around it as much.
Yeah, I can remember, like you said, it must have been like 15 or 20 years ago, people would be in a sling for like weeks at that,
Right.
And that's not the recovery time anymore. All right, let's talk prevention. What are some do's and don'ts for keeping our wrists healthy?
Yeah, so really avoiding, like we were mentioning earlier, this wrist bent or extended position. I think that's really a tough position for the wrist in general. But if you're starting to notice these symptoms and you find yourself in those positions a lot, that's really the thing you want to try to limit or reduce. That's going to help try to prevent this from worsening, because that's what it tends to do with time.
Okay. All right. And so then how important are posture and ergonomics in our everyday kind of life to make sure that we're protecting our wrists?
Yeah, I think the biggest thing, if you can find yourself, ergonomic positions for your wrists at a keyboard, or if you do a lot of work with your hands. I think people who use vibratory tools a lot, or things that are very kind of heavy grip type activities, if it's work or recreation, just trying to place your wrist in a more functional position, again, in that neutral type of position, so that you're not forcing the wrist to kind of be utilized in a way that it's not designed.
Okay. And so with that, in mind, are there stretches that you can show us that can help so that we can kind of ward all that off?
Yeah, so we call them sort of median nerve glides or tendon glides. So a lot of times we'll just show people simple things where you're stretching your wrist back slowly or stretching it down slowly, kind of working your fingers in these positions back and forth. And what you want to feel is more of a stretch type of motion, not feeling pain or creating more numbness. Those kind of things just done gently and repetitively throughout the course of the day, maybe while you're taking that 20-minute break from typing or something like that can often alleviate this problem so that as the day goes on, it's not getting worse and worse, because that's usually what people sort of describe.
Right, for sure. All right, so as we're wrapping all of this up, what final thoughts or advice for keeping our hands and wrists strong and pain-free for long-term wellness? Because that's what the key is, right? Long-term wellness.
Right. I think a couple of big things are, if this is progressing more, it's not responding to the easy things, come in and get seen. There's a lot of really good techniques out there to alleviate it. Carpal tunnel is a very fixable problem from a surgical standpoint, and we can really kind of restore people's function and activities very quickly. Another thing that I always like to mention to people, but I think is important, that if you've had carpal tunnel release done in the past, it doesn't mean that it can't recur. So I think a lot of people don't fully understand that if they've had it done maybe 10, 20, 30 years ago, and they're starting to notice the same symptoms again, this can come back. And so it's something that you don't want to necessarily ignore, even though you've had it done before.
Gotcha. Good points. All right. Thank you so much for your time and expertise. If you want to watch this interview again, maybe you need to send it to a friend or a family member. It's going to be in the To Your Well-Being section of our website.